First of all, welcome to the School of Nursing Nursing Rounds. And this is the first one of 2025. And my name is Sabrina Wong, and I'm the Associate Director of Research here in the School of Nursing. And I want to acknowledge that I'm sitting today on the unceded territory of the Musqueam people, and I'm very grateful to be able to live, work, and play in the Coast Salish territory today. I also want to introduce Dr. Naz Havaei, and she is going to talk to us today about raising our voices and trying to increase the effectiveness of resident and family councils in long-term care homes.
Great to have everybody here. I think this is the group, since it's very small, I think we're going to have some very fruitful conversation at the end of the presentation. So what I'll do is I'll just go ahead and share a screen. Are you guys able to see my screen okay? Can you, for those of you, some of you have your perfect. Thanks, Sabrina, for giving me the thumbs up. It's really hard to see everybody's faces. So I'm really pleased to be the first presentation of the year and happy to share the findings of our research entitled Raise Your Voice, How to Increase the Effectiveness of Resident and Family Councils in Long-Term Care Homes. I know Sabrina already did a land acknowledgement, but I'd like to also respectfully acknowledge that the University of British Columbia is located on the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. And I'm really grateful for the opportunity as a settler to live, study, and play on these lands. In terms of our agenda, I'm going to very briefly talk about the project funding, the project team, and then provide an overview of the project in terms of the background, the study purpose, methods, findings, and then there are a few take-home messages that I'd like to also share with all of you at the end of the presentation. So this project would not really have been possible without funding support from UBC's Health Innovation Funding Investment Award that was given to our team in fall of 2023. But more important than the funding support, I would say, was really the tremendous support that this project received from an expert team of researchers and knowledge users. First and foremost, we've been very fortunate to do this research in close collaboration with Lisa Dawson and Kim Slater, both of whom have extensive experience in supporting long-term care resident and family councils across the province. We also had Dr. Sheila Novak, who is a long-term care researcher and has some experience in studying long-term care councils. And I believe that Sheila is actually a recently appointed assistant prof at Brandon University in Manitoba. But at the time of the study, Sheila was actually a postdoc with Dr. Allison Finney at UBC School of Nursing. The third acknowledgement goes to my research manager, Megan Polius, who actually ensured the project really stayed on budget and on timeline. Amira Ahmed, a PhD student in filming at UBC Okanagan, supported the creation of the short film that we actually generated as part of this research to raise public awareness, both around the existence and also the value of long-term care resident and family councils. And I'll be sharing the QR code for this film at the end of the presentation. And last, but definitely not least, my PhD student, Sabina Stamfli, who managed various aspects of the project, from recruitment to data collection, data analysis, knowledge translation, all of it. But unfortunately, Sabina could not be here today with us as she's currently on maternity leave. So long-term care legislation in many jurisdictions in Canada require long-term care homes to provide residents and informal caregivers. And by informal caregivers, I mean families and friends of residents with the opportunity to have their voices heard regarding, their needs, their likes and dislikes, and the direction, priorities, and the day-to-day operations of the long-term care homes. And in long-term care homes, particularly in our province, the voices of residents and their families and friends are increasingly being heard via resident and or family councils. And I would say that, the driver of this research was our pandemic research that actually showed that many of the unintended consequences of pandemic management policies or strategies, like, the strict visitation policy, could have been either prevented or minimized if we had done a better job with more systematically capturing and integrating the voices of residents and informal caregivers into decision-making in long-term care. In November of 2022, new long-term care regulation was introduced in the province of BC, mainly to strengthen the position of resident and family councils in long-term care homes. And the new regulations essentially require long-term care operators to support the operation of resident and family councils and to promote their independence. For example, by providing administrative support, meeting space, as well as meeting with the council on invitation and following up to council requests and communication. And there is really no prescriptive definition of resident and or family councils, but broadly speaking, these forums essentially refer to groups of residents and or family members who meet on a regular basis for the purpose of maintaining and improving the quality of life of those living in long-term care homes, so our long-term care residents. And there are a variety of council structures out there. Some councils could be either composed of only residents. Other councils may be composed of only, families and friends of residents. But we also have joint models that include, both residents and families in the same council. And that is why throughout this presentation, I've been referring to family and or resident councils to essentially portray that these various structures are out there. Our literature review showed that, long-term care councils had various purposes and goals, from, research that my colleague, Dr. Jennifer Baumbush, had done, and identifying the purpose as, providing information and peer support, to promoting collaboration and communication among leadership, families, and residents, facilitating resident and family input into decision-making, promoting resident rights and collective action. I mean, a bunch of goals and purposes, but I would say that the overarching goal of these councils is to maintain and improve the quality of life of the residents through these other objectives, sharing information, promoting collaboration, communication, and whatnot. Although various versions of resident and family councils, forums, or groups have been in practice, internationally for decades, research on the factors that enable them to achieve the aforementioned goals and improve resident quality of life remains, for the most part, it remains really limited. And our research really addresses this gap by investigating what are those factors that contribute to the effective functioning of family and or resident councils. And we're going to be providing suggestions for families, residents, advocates, and long-term care staff and leaders to essentially overcome barriers to ensure that the voices of families and residents are heard and considered in long-term care decision-making across BC and also beyond. To accomplish this study purpose, we established a partnership with the Independent Long-Term Care Councils Association of BC. the acronym is really challenging, and that's why I put it on the slide, ILTCCABC. And so we conducted a qualitative study of resident and family council effectiveness in BC in partnership with ILTCCABC. And for those of you who may be new to this area, ILTCCABC is essentially a provincial association of family councils representing the collective voices of residents, their families, and representatives. And, you know, the association is essentially comprised of its member regional associations of family councils, which operate in every health authority in BC. And they're viewed by the Ministry of Health as a really important partner or stakeholder in the long-term care sector. And one of the really main things that the ILTCCABC helps with is the development and maintenance of independent resident and family councils in long-term care homes in the province. So in terms of our approaches, as I said, our study was participatory in nature. We had knowledge users, including ILTCCABC representatives and other long-term care advocates involved throughout the research process, you know, including from recruitment to data analysis, data interpretation, and knowledge mobilization, to the point that we actually had our, you know, long-term care advocates and ILTCCABC representatives actually participate in every data analysis meeting to make sure that our approaches were on the right track, and, you know, the way that we went about interpreting the findings actually made sense to them. And we also, both of those individuals are knowledge users, Kim Slater and Lisa Dawson are both co-authors on the research paper that we recently published, or actually it's been accepted for publication from this study. But the knowledge users, you know, also informed other aspects of the project. They actually helped us create a list of potential participants. You know, a recruitment email request was sent to these potential participants, who were asked to respond to the research team if they were interested in participating. And to improve response rate, you know, family members and resident participants were offered a $25 Visa gift card to essentially both acknowledge their time, but also expertise in this area. And the 3 follow-up emails were sent over 1 month to encourage participation and make sure participants have essentially enough time to think about the participation in the study, and to, you know, if they had any questions, to send them our way and get them clarified. So these approaches resulted in a total of 17 participants who took part in either one of the 5 focus groups or the 2 one-on-one interviews that we conducted as part of the study. Participants were made up of residents and families who participated in resident and or family councils and long-term care advocates and leaders. We conducted 1 focus group with resident council participants, 2 focus groups with family council participants, 1 focus group and 1 one-on-one interview with advocates, and 1 focus group and 1 one-on-one interview with long-term care leaders. Of note is that all of our participants had many years of experience related to long-term care councils in BC, and had roles, you know, ranging from council chairs to council participants to CEOs of long-term care homes, advocacy program directors, and clinical specialists. In terms of data collection and analysis, we conducted our interviews in focus groups via Zoom. They lasted somewhere between 60 to 90 minutes. We had those interviews and focus groups recorded on Zoom, send them for transcription, and then analyze the data using phenomenologically informed framework analysis. So I'm going to switch gear now to talk about the study findings and essentially answer the question of what makes a council effective. So this figure that you guys are looking at right now It's essentially a condensed, it's a chart that is a condensed version of our findings. And I'll go over each of these parts in more detail to give you guys an understanding of the factors influencing counsel effectiveness. And then we'll discuss how these findings can be used at the end of the presentation. So our participants perceive to be there to be both non-modifiable, so outside of their control to modify, and modifiable within their control to modify factors in relation to counsel effectiveness. So participants reported that residents in long-term care homes are increasingly medically complex, and a large portion of residents lack the capacity to participate in counsel meetings and or articulate their own perspectives. In relation to that, one resident participant said, and I'm quoting, "Getting the right people out to the council meetings, people who can speak and who can articulate concerns, as well as positive things that they want to say is really important." In addition, participants reported that the average time that a resident spends in long-term care can be very short, which affects involvement in councils and also affects council succession planning. And in relation to that, one family participant said, "One of our most difficult challenges with family councils is that we have such a small pool of people to draw from to build our councils. People come in, they might be in for a couple of years, they pass away just about the time that they're starting to learn. If they've joined the council, they're starting to learn about the long-term care system and how to have more of an effective counsel. Their loved one passes away, and then we start with someone new." The participants saw both of these factors as non-modifiable factors, factors that they have no control or very little control over. But there were also many factors that participants felt could be modified, including communication, the structure of the council, recruitment and engagement, council leadership, culture and attitudes, and resources and supports. First and foremost, counsel effectiveness was perceived to be heavily influenced by communication practices between councils and the long-term care leadership and staff. Communication, our participants said communication was most effective when it was ongoing, transparent, and closed loop. So ongoing refers to having a frequently used and defined avenue of communication. For example, contact person in management, or maybe an agreed upon method of communication, for example, through in-person meetings or email or whatever is agreed upon together. Transparency refers to, sharing information with each other as much as possible, so everyone is on the same page. And this can be promoted by inviting leadership to council meetings to answer questions, share perspective, sending out meeting minutes, so on and so forth. And by closed loop communication, it essentially means when requests are made or concerns are brought forward by councils to leadership, that the council is actually provided with direct feedback regarding this particular request with a timeline, or alternatively, a contact who might be better suited, better positioned to address the concern. And so in relation to this, one long-term care leader said, "I think what also helps councils become successful and help with successful relationships with leadership is having a communication platform where they can share information. We have a family council tab on the website where they can put information, exchange information, which is important for their own transparency and people who want to access that information. Over the years, we've been able to establish very clear understanding about communication between the council's executive and the senior leadership of the organization, which essentially helps with transparency and strengthening relationships." So the quote really nicely illustrates the importance of communication between council and leadership as a factor that influences council effectiveness. The second modifiable factor that was found to be very important to council effectiveness was the council structure. Many participants considered a proper structure to be fundamental to successful councils. And, well-structured councils were characterized by councils that had their meetings recorded in some way, where meeting minutes were kept, that there was a term of reference, where council roles were clearly defined, and where councils, were independently led without interference by leadership or staff. And, our participants felt that a good council structure essentially reduced the likelihood of conflict within councils and also increased engagement with long-term care residents and families. And having an independently run council essentially increased the likelihood of being able to share sensitive and challenging topics among peers without having a fear of repercussion. And in relation to council structure, one long-term care advocate said, and I'm quoting here, "The council and I set up terms of reference that define how family council is going to operate. We also wrote out a profile of what the chair, vice chair, and secretary's responsibilities and characteristics should be in that role. We defined the chair's roles as being somebody who has the whole facility's well-being in mind and who has a track record of good collaborative skills. So we made sure that the council was behaving properly, because confrontational people, like in this example, are a family council's worst enemy, because they can give council a bad reputation." And as you'll see later on, this quotation is also somewhat related to cultures and attitudes about council, that other factor that I'll sort of go over in a little bit. All of our participants emphasized the challenges of recruiting and engaging residents and families in council, and unanimously agreed that recruitment and engagement is essential for councils to run effectively. Participants recommended ongoing and strategic efforts to recruit and engage residents and families as a key feature of effective councils. And one advocate in relation to that said, successful family councils must have a strategy to keep building membership. Turnover in long-term care is much different than it was 15 years ago. Residents don't live forever, and so it's hard to sustain council membership, let alone build it. But that has to be an absolutely critical part of a family council strategy. How are we going to inform people about what councils do and get them involved? We need to make sure families understand that they have a voice. So the other factor was council leadership. And so councils led by skilled and experienced council members were considered by our study participants to be most effective. Effective council leaders keep council meetings organized and hold, long-term care long-term care leaders accountable. And, some of you may know that entering the long-term care system is a very complicated and challenging learning process fraught with very deep emotions. And as per our participants, the most effective council leadership is able to support the council participants with their learning process, and also educate them on long-term care legislation and give them any other information that they need and sort of meet their education needs. And this advocate, who was at one point the chair of family council in their mom's care home, said, "I went through my mom's Alzheimer's for all those years, and I used to learn little tricks like setting up a calendar of what activities she did during that day. So the calendar became her memory for the day. I would share that idea with other families who had loved ones in care with Alzheimer's. Little tricks that would make things better. And if I can't belong to that council, I can't share that kind of thing." So there's also a bit of overlap between this quote and engagement and recruitment of council participants. The participant, the advocate, is talking about their mom passing away, and because of that, they're no longer to be able to be a part of that family council, and therefore there's a bit of a loss of knowledge, loss of experience in that process. Many of our participants also reported persistent misconceptions about the purpose of councils in the long-term care community, which inhibited council effectiveness. One of our leader participants explained that family councils are frequently misconceived as a place where you go to complain, and that this misconception prevents participants from engaging with councils. And this is just one example, but some of our participants emphasize that there are misconceptions about councils that exist in some long-term care cultures, which severely inhibit council effectiveness. In relation to that, one family participant said, I would say probably 60% of the people that were in our family council would not bring forward a concern directly because they were so fearful of reprisal against themselves in how they would be treated if they complain, or worse, any retaliation against their loved one. 80% or more of the people have dementia. And for a person with a loved one with dementia, it's frightening to walk out of that facility and wonder what's happening behind closed doors. So there's this fear of being punished as a result of speaking up and sharing concerns. Our last modifiable factor that, according to our participants, impacted council effectiveness included having proper access to proper resources and supports. Could be private meeting space, equipment to run hybrid meetings, a designated staff member to facilitate or support resident council meetings, and connections with the regional council association. So ILTCCABC is the one association that I'm referring to, or the association within each regional health authority. In relation to that, one family participant said, one of the upsides to the COVID experience, there were a fair number of resident and family council meetings held by Zoom, and suddenly family members who were on the prairies, on the East Coast, somewhere in the States, could take part. Zoom meetings actually turned out to be well attended by people who would not normally be able to attend. The council participants were able to hear what was going on directly from management, and if they had any concerns, they certainly could speak up and comment. So going back to this figure, we talked about our key findings in relation to council effectiveness. And just to summarize, we talked about a couple of non-modifiable factors and a few modifiable factors, namely communication, structure, council recruitment and engagement, council leadership, the care homes cultures and attitudes about long-term care councils, and access to proper and appropriate and adequate resources and supports. So what can we do with this information? Something really interesting that we did as part of this research was that we actually integrated the modifiable factors into an instrument, a measurement tool, where anyone can essentially download and complete the tool. And the tool essentially provides an understanding of the extent to which council is perceived as effective or ineffective according to our tool. So the tool includes, if I go back, these 6 domains, and there are statements or items under each of these 6 modifiable factors, 6 domains within our tool. And the tool would both tell us how effective is a particular council, and also what are those areas that are areas of strength. Maybe their communication is their area of strength. Maybe the council structure is their area of strength. And also, what are those areas that are areas for improvement? Maybe they're struggling with their council leadership. Maybe recruitment and engagement is something that they want to work towards. The instrument has 35 items, 6 domains. It's a measure of counsel effectiveness. We had this instrument reviewed by several subject matter experts and also our knowledge users. And we went through several rounds of revision based on their feedback. I've included the QR code here if anybody's interested in having a closer look at the instrument. I'm just going to pause here for a sec, just in case anybody wants to get their phone and scan the QR code. Otherwise, if that's an issue, do send me an email and I'll be happy to share a copy of the instrument with you. So as I said, the tool is available publicly. Anybody can complete it. And each long-term care home and each council, as they have unique needs and unique areas of strength and areas of improvement. And each question in the instrument gives an idea of where specific improvements can be made. So as an example, question 15 on the instrument asks about, long-term care home informs newly admitted residents and families about engagement opportunities with the council. So that's an example of an item under recruitment and engagement. So as a council participant, you might be struggling with that area. And so this sort of measurement tool will actually be able to tell you that if you're the one maybe experiencing this issue, or if everybody else within the council is also sort of having similar experiences. So as I said earlier, we have our journal article accepted for publication, and I believe it'll hopefully come out in the next few weeks. It's open access, it's available to everybody online. But in addition to our journal article, we also created a short film to raise awareness about the existence and the value of councils. And the Vancouver Coastal Health Authority, their long-term care sector, has taken up our short film, and I believe they're sharing it with newly admitted residents and families at this point. The film is available on the School of Nursing YouTube account. If you want to take a look, I've included the QR code over here. It's right here. It's been viewed by probably around 1,100 views thus far, and hopefully it'll go up over the next few months. We have been invited to present the findings of our research within various health authorities and their long-term care home network. And our next step is essentially to conduct a provincial assessment of council effectiveness using our instrument. We are in the process of discussions with the few health authorities, Vancouver Coastal, Fraser Health, and a couple of others to essentially gauge their interest in establishing a baseline on council effectiveness. Currently, there is no data, provincial data on this topic. It'd be really interesting to both establish a baseline, but also to look at contextual differences. Are there differences or similarities in councils across, different geographical regions, different long-term care home sizes and funding models? Some of those contextual factors that we know are important in relation to long-term care delivery, whether or not they also have an impact on council effectiveness. And then from that point on, how can we support long-term care councils across a diversity of characteristics, whether they're urban, whether they're rural, whether they're public, private, so on and so forth? How can we best support them? So that is the gist of what I wanted to cover with you. And all the resources, the short film, the instrument, the visual depiction of our key findings, all of those resources are available on the UBC Hope Lab website if you want to take a look. If you have any questions about any part of the research or any of the outputs, do send myself an email. Sabina is on maternity leave right now. And if you want to learn more about ILTC CABC, please do reach out to Lisa Dawson. Fantastic. Thank you for the opportunity. And do reach out, guys, if you have any questions or if you see any possibilities for collaboration, please do reach out.